Is deep brain stimulation a good option for epilepsy? Imagine a treatment that can help control seizures without removing parts of the brain or relying solely on medication. That's where deep brain stimulation comes into play. It involves placing tiny electrodes in specific parts of the brain to help regulate abnormal activity that causes seizures. This approach is especially considered for people whose epilepsy does not respond well to medicines or who are not good candidates for surgery to remove the seizure focus. Deep brain stimulation has been most studied and approved for targeting the anterior nucleus of the thalamus, a deep brain structure involved in relaying signals related to seizures. The results from clinical trials show that about 40% of patients experience a significant reduction in seizures after starting treatment. Over time, some patients see reductions of up to 70 or 75%. A small percentage, around 14 to 20%, even become seizure-free. Many patients report that the benefits last 4 years, and side effects are usually mild. Common issues include temporary memory problems or dizziness, which often improve with time. Overall, patient satisfaction tends to be high, with many feeling the treatment has made a positive difference. Other areas of the brain can also be targeted with deep brain stimulation. For example, the centromedian thalamic nucleus has shown promise in reducing seizures in generalized epilepsy and conditions like Lennox-Gastaut syndrome, with seizure reductions often between 50 and 70%. The hippocampus, a brain region involved in temporal lobe epilepsy, has also been targeted, with seizure reductions sometimes reaching over 90%. The choice of target depends on the type of epilepsy and where seizures originate in the brain. Deep brain stimulation is not suitable for everyone. It is generally considered when medications have failed to control seizures and when surgery to remove the seizure focus is not an option. Advanced imaging techniques help doctors identify the best candidates by revealing brain structures and guiding precise placement of the electrodes. Compared to traditional surgery, deep brain stimulation is less invasive and does not involve permanently removing brain tissue, making it a good option for complex or widespread seizure networks. However, it requires ongoing management by specialized epilepsy teams to monitor and adjust the device. It's important to remember that every person's epilepsy is different, and what works for one person may not work for another. Consulting with epilepsy specialists is essential to determine if deep brain stimulation might be a good fit. Overall, it is a scientifically supported, effective, and safe option for carefully selected patients with drug-resistant epilepsy, especially when medications and surgery are not enough. But, as with all treatments, decisions should be personalized and made with professional medical guidance.